Hello, everybody. You're here with Claro Beauty with your host, Claudia Lara. Thank you very much for tuning in and for watching. And why we're here, I was going to say, please subscribe to my channel now. Please ring the bell in the right-hand corner so you know when I upload new videos. It's important for me to say that, but then I don't know okay. So, to the topic at hand. I just wanted to come in here very quickly. First of all, to thank you very much for all your messages on the last update, and for all your sharings. You know, your experience with the traveling, or your experience with the passing of a family, or all of this. I really, really appreciate it. And the power of prayer, yes, or best wishes, or community coming together. After reading all your messages, after sharing that video, I felt this wind of new energy, which is amazing, very lovely, and thus why I feel like filming today, and also many things shifted. So that's the power of prayer. So that leads me to make this video about hospice. And so I hope I don't get in trouble for sharing this, but it has been my experience. And I believe there's very, very little amount of information about going through these things, these medical things, and perhaps I'll do a video without my experiences, because today I just want to mention a little bit of hospice. But, my mother-in-law died 3 years ago, and so we went through a whole thing with her. And then my mother has been in the hospital like 4 times in the last 2 years, so then we went through all of that. And then my father-in-law has been in and out of a hospital, and also with Alzheimer's, and living with us, and assisted living, and all of this jazz. And so I have had to learn quite a bit the last few years about this part of life, the caregiving of your parents or seniors. So perhaps I'll do a video on that. But hospice, what just happened today, was very interesting. So this is what I understand so far. When you say hospice, to me, I felt it was a place where people go to be taken care of, to give comfort for them to pass. And that's as much as I knew. And even my mother, who's in her 70s, she Googled it and sent me the description. What I learned is the following. So hospice, at least in the United States, can have different levels of service. And what that means is they can either, number one, provide you the medicine and the tools that you need at home. So they will cover that. And I am guessing, because this was the interesting part, that people can't speak openly because there's a lot of legalities. So they have to use the right wording, and that makes it very confusing for the consumer or the one in need, which is the family members, not the patient, because the patient is usually not involved in the conversation. So what I think it means when they put it like that, it will cover the medicine and the tools needed, is mainly these medications for pain or for help passing. Not very sure of that, but medications that you wouldn't find over the counter or just with a prescription of a doctor. I guess these are medications that need to be a little more regulated or taken care of, which I understand. So the level 1 is the hospice will provide this for you at home or an assisted living. The second level of care, or level of hospice, is where they will actually send somebody, perhaps daily, several hours a day or more, depending on the need. Again, it could be at your home, or it could be an assisted living, or whatever you are choosing the patient to be. And then there's this third level, which is a place. Now, this place can be a clinic, or it can be in a hospital. It's just a different area. So it's not like I imagine it, where it's kind of a place with different beds and perhaps people. I don't know what I thought, but no, it could be as a hospital area looks, and with rooms and things. Now, what is the difference between having them in a hospital or having them in hospice is the intention, right, and the care. So usually they have at least double the amount of either volunteer nurses that are taking care of the patients. And the idea is so they can be accompanying more, that they're not being left alone for the most amount of time, or when they call for somebody or for something, that they will get somebody there right away. And the intention is, again, to make them the most comfortable, but help them pass. That's the intention. Now, they will not resuscitate, they will not intervene. If anything goes wrong with the body, they will not intervene to help them get better or heal or make a surgery or, whatever the body needs. They would only appease the pain or, being there holding their hands, which all of that sounds, wonderful, right? I mean, if somebody's dying, at least you have somebody there. It's very human. Humans? No. So that's all good. However, it is a very interesting decision to make, because that means there will be not much hope for the patient to recover. And I know sometimes that's the medical condition, that's what it says, right? There's not much we can do, or there's not much left, or the person is dying. In the case of what I've been through, is sometimes the person is in the hospital after surgery, and everything becomes very complex, and it all is directing towards there's nothing else that will be done. And if you make the decision to move them to hospice, then what I hear too is most likely that's the trajectory they're going towards. And this is in whispers, because you're talking to different people with different angles, because then also there's money involved, right? Who gets the patient is making money on the space and service. So the only useful part is that every person tells you the angle of the other person, sort of thing. And I believe that is very confusing for whoever is going through, because first you need to learn a lot, you need to see who you trust, you need to read between the lines. It's just very uneducated. I think we need a little more education on those stages of life and what we can do, but in an open way, not in this whispery, read between the lines, something is said but not said, something like that, which I think is happening. So in any case, in this circumstance, we were so pressured that we receive a call every so often through the day. What are you going to do with the patient? What are you going to do with the patient? And in our case, we just wanted to wait. Why wait? Because time is of essence. Because if you just came out of a surgery, you need time to recover. If there's any recovery, the body is very wise, and is always trying to heal itself. So in our circumstances, my father-in-law came out, and he couldn't even move his tongue left and right because Alzheimer's, and that Alzheimer's also starts making difficult for the person to give direction to the body. So it was said he no longer will be able to eat. They did several tests. He couldn't swallow. So unless he is with a tube that feeds him, he will not be able to eat, and then he will pass. So that's hospice. For some reason, intuition mainly, we decided that there was a 10%, no, a 5% hopeful outcome. And, my father-in-law is in his 90s, he's advanced Alzheimer's. He looks skinny. I mean, he looks like he is towards the end, right? But when I ask him, are you hungry? Yes. You want to go home? Yes. Granted, he doesn't make a lot of logic, and usually doctors tend to dismiss completely what the patient says, either because of their age, because of their sickness, or because they're too drugged from the medications. But for us, the family, we decided to follow that. And so we decided not to go to hospice. And we sent it back to assisted living, where also we were, in communications that they will be willing to try to revive him, at least feed him. And it's not that in hospice they don't feed them. What they call it, or the term they use, was pleasure feeding, which means if the patient asks for something, or perhaps they'll try, but they won't try to feed him nutritional value to keep him alive. And so we wanted him to go somewhere where they will feed him nutritional value food, that try to revive him, try to get him up out of bed. And so we made that decision, knowing that perhaps it might not be the right decision. We said, well, if that's the case, then we'll end up bringing him to hospice. And so we decided to do that, to send him to assisted living again, where is his home for the last 3 months, and obviously have the hospice service, which is medication and tools. And I'm just happy to report he's up, walking, sitting down on the table, and eating nutritional food. So again, we're very happy, of course, but I just wanted to make this video because I couldn't find anything about it. And I hope I don't get in trouble. I'm trying to be very, just in my own experience, what I saw, what we decided, what I learned, without much detail. But I don't know, guys, community, strength, if you have, they say give up on your family member. I don't mean it like you don't care about them. But it was much easier to say, look how he is. He's going to hospice. Is done. And I don't know. We felt, well, what if it's not? It was just that little something. What if it's not? And so we find out that it's not. And perhaps he doesn't live that long anyways, further. I don't know. But at least I know that we didn't put him into some words, and some words they say like more dead end, or, there's this whispers that people talk about the places. And so I have to be very careful, because I'm sure it's very good for certain circumstances, and I'm actually very appreciative that it's there for certain circumstances, because the way with all that my father-in-law was connected to, it would have been extremely difficult to bring him home, or somebody that is not trained for everything that was happening. And I know, because I dealt with this with my mother, and we didn't have the training, and she came home, and that was another story. But so I just wanted to share this with you all, in case it's useful, in case you go through something like this. Anyhow, that was it. So, end of story. It's all good news. He's back in assisted living. He's out of the hospital. He's standing up. He's eating. I don't know for how long, but this was not his time. And here we are. So, on the other hand, if you saw my other video, we are still going with the move. So I'll keep you posted about that. Thank you very much for watching, and please subscribe to my channel, ring the bell in the right hand corner, and we're gonna go back to makeup, of course. And till next time, bye bye.